So there are really a large array of use cases. Instead of giving you a list of use cases, let me help you think about use cases in sort of lanes. So when you look at the benefit networks and the benefit coordination, the use cases that fall under the benefit administration that we are currently working on are the obvious ones are eligibility and enrollment, and the more interesting ones are referral management and access to care in terms of both in the context of chronic disease as well as episodic care, looking at things like adjudication in real-time payment using tokens. These are all the use cases that are already in various stages of discussion. What gets really exciting is when these multiple cards start interacting with each other. Having an eligibility card is cool. Okay, it saves me a lot of hassle. I don't have to call the insurance company to verify my benefits. All that is wonderful. It's already great. But wouldn't it be much better if my eligibility card can interact with the provider's claim card and the adjudication can happen real time? Now that's way more powerful. So individually as a Care.Wallet user, I love my eligibility card. Individually as a provider, you love your claim card. But when our cards interact, now it's magic. So what we are really focused on is really what we call card decks, where cards interact with each other to create very significant performance improvement or process improvement. So we are focused on the benefit side of that, driven by the payer community. The second track is clinical, and that's really something that I talk about with great personal interest. And we are focused on diabetes care, followed by other chronic diseases that we are looking at: cancer and cardiovascular disease and mental health and obesity and mobility and stability. These are the big issues that plague humanity across the world. So our focus is on delivering care management, best practices, education, guidelines, compliance, prescription utilization, reminders, refills. These are the type of use cases that are being explored and developed on the clinical care side. The primary objective being that we want to have the wallet holder have access to information that would allow them to interact with the physician to get the best possible results. Not be a passive recipient of healthcare, but an informed, engaged manager of their health. So that's where we are. We have a lot of use cases there. And we are marching down this path in a very methodical fashion. And then last but not the least is the payment side, which is payment coordination. And there are three big areas. One is real-time adjudication and payments of care, which is essentially streamlining and eliminating this big round trip of you go see the doctor bills me, 90 days later I send a check, then the doctor comes back to you and says, hey, you need to pay me a little bit more because insurance company only paid 80% of my bill. That whole journey is easily 6 months for a doctor. And we want to make that 6 seconds. So there's that use case, and that's really compelling. The second use case category that is really compelling in financial side is coordination of benefits, which is when more than one insurance company is involved, more than one payer is involved. When somebody, you the patient, me the insurer, and Maria the co-insurer have to coordinate payments for a single health episode. Happens more often than you might think. So that's a really complex and really powerful use case that we are pursuing. And the third one is around incentives, rewards, and value-based contracts, which are around not just paying for services, but we're paying for results. And that's an entire field in itself around value-based care contracts, value-based payments, value-based care quality measurement. But that's really important because you're not just paying for Pradeep to go see the doctor. You're paying for doctor to make me well in the most optimal way possible given the circumstances, and paying the doctor more if I don't regress back to my previous condition. So in the form of a hospital admission, getting me discharged from the hospital is good, keeping me out of the hospital is even better, right? So those are the type of payment use cases that we are looking at. And ACN is a great partner in that innovation. They are a great payment innovator. And we love sitting with them and brainstorming on what kind of payment innovation can we bring to the market, not just for them, but for all their clients. So that's really all our clients, pardon me. So this is the areas where we are actively working on the care cards.